Welcome to the Retirement Made Easy podcast, a show created to be your go-to source for straightforward retirement advice. Best of all, it is presented in a language that you can understand. Are you ready for some straight talk on retirement planning without all the fluff? Well, you found the right podcast. Here's your host, certified financial planner, Greg Gonzalez.
Hey, welcome to another episode of the Retirement Made Easy podcast. I'm Greg Gonzalez. Thanks for joining me today. So recently I've had a couple questions about Medicare planning. And for those people that are approaching retirement, hey, Medicare is one of those topics that a lot of people want to learn about and hear about. And 2019, according to Social Security, there were 61.5 million people on Medicare. By 2027, just 8 years later, there's predicted to be 75 million Americans on Medicare. In just 4 years from now, 2027, Social Security is anticipating 75 million people, Americans, on Medicare. I'm surprised, I really shouldn't be, that people, they don't talk about Medicare. I guess their friends don't talk about, or maybe they're misinformed. People don't know really how Medicare works very well. What they do know is they get close to 65, they're going to be literally bombarded with so many different mailings and advertisements of Medicare supplement plans and Medicare Advantage plans as they get close to their 65th birthday, because for a lot of people, that's a big decision to make if they are retired or don't have access to a group health insurance plan. And I've said on this podcast numerous times that the number one reason people, in my experience as a retirement planner, the number one reason why people push off retirement, it's not because their 401k is down or the stock market makes them nervous, because health insurance is so darn expensive. That's the number one reason I see people push off retirement. And if you're curious, the number one reason I see people retire before they had anticipated, well, it's really due to either layoffs or declining health. By and large, that's what I see. And we don't have to get into the whole layoffs thing, but I could go on and on. There is age discrimination, especially when a company is laying off. The higher income earning people are going to be the people that have all those years of experience and all the wisdom, right? They're the higher end on the pay scale. Corporations or organizations are going to lay off the people that are the high income earners to save on costs. And if you think about that person that gets laid off that's 60 years old, that wanted to retire at 62 because they know they've listened to Retirement Made Easy podcast and they know 62 is the most popular age people retire in this country. They've got 2 more years. They had planned on working, so they were wanting to retire at 62, get laid off at 60, and they're kind of thinking, gosh, I want to retire in just 24 months. Who's going to hire a guy or a gal that wants to retire in 2 years? And not only that, pay me what I'm really worth. I was in my peak earning years when I just got laid off at my former position. So I've definitely experienced that and worked with people that are in that very, very same situation. And of course, that 60-year-old person is saying, gosh, what do I do for health insurance for the next 5 years until I'm eligible for Medicare? They know, okay, I'll have COBRA here for 18 months, or maybe their severance package had some kind of health insurance included in there. But oftentimes, health insurance coverage is a big concern. So on today's episode, let's jump in and talk about Medicare planning. Let's talk about the IRMAA tax, what it's going to cost, all that kind of stuff. I've been getting a lot of questions on the website, retirementmadeeasypodcast.com. At the bottom, you can submit your questions. It says, Ask Greg a Question. And I've had a couple listeners some Medicare questions recently. So that's why I wanted to talk about this topic on today's episode. I also had some prospective client meetings, some people that were wanting help with retirement planning, either in person or over Zoom or a phone call. And Medicare frequently comes up. Hey, how do we plan for Medicare and health insurance in retirement? And how do we pay for it? And I even had one lady say to me, well, gosh, you know a lot about Medicare and health insurance planning. I said, I thought you were a financial advisor. My current financial advisor, all he talks about is investments the entire time. He doesn't know anything about Social Security or Medicare. And I said, well, it kind of sounds like he's an investment specialist or a investment product specialist. We do things a little bit differently here. We're more geared towards retirement planning. And yeah, your investment portfolio is certainly a piece of the puzzle that we want to consider. But again, it's just one part of an overall holistic plan. So on today's episode, we're not going to talk anything about investments. It's going to be strictly Medicare planning. So, hey, I mentioned my website, retirementmadeeasypodcast.com. While you're there, you can download some of my retirement planning resources under the resource tab. You can listen to all 146 previous past episodes right there on the website. And then you can sign up for a retirement coaching call. For those people out there that are looking for help with retirement planning, hey, there's a link to my calendar right there. Set up your 30-minute phone call and let's talk about your situation. All right, let's jump into today's topic, which is Medicare planning. What does it cost? When do you sign up? All that good stuff. So Medicare has different parts. So you have to understand which Medicare part that you're talking about and what it covers, what it costs, all that good stuff. So typically, generally speaking, people are eligible for Medicare once they turn 65. Now, there are special situations like if someone becomes disabled prior to 65, where you may run into somebody who maybe is disabled, fully disabled, and they're eligible for Medicare prior to 65. But there's special rules with that. But for our purposes on this podcast, age 65, you're eligible for Medicare. Like I said, there's different parts to Medicare. I will try to touch on the different parts and explain what they are, how they apply, that kind of thing. So we'll start with Medicare Part A. So Medicare Part A, that is hospital insurance. It covers inpatient stays at places like hospitals, skilled nursing, mental health facilities, that kind of thing. Most people are not going to pay a premium for Medicare Part A, and it's not income-based. So there's not IRMA, which is we'll get into a little bit later in the podcast, is it does not impact your Medicare Part A premium. So when can you sign up? Well, there's a special enrollment period 3 months prior to your 65th birthday and 3 years after. It ends 3 months after your 65th birthday. It's 7 months. They include the month in which you turn 65. So 90 days before your 65th birthday, you could sign up for Medicare Part A. Well, if you claimed your Social Security benefit at age 62, guess what? They already enroll you for Medicare Part A, so you don't have to do anything. Same thing if you started your Social Security benefit at age 63 or 64. So let's keep going. Then there's Medicare Part B. Medicare Part B is medical insurance. It's going to cover like outpatient health services, preventative care. For most people, this is going to be your everyday health services, right? The next thing about Medicare Part B that you need to know is it's not free. There is a premium and it's income-based. And this Medicare Part B premium, it does not pay for all of your medical services. It will pay for 80%. So then you would be on the hook to pay for the other 20%. And there is an annual Medicare Part B deductible. It's $226 in 2023. So what is the Medicare Part B premium? Well, for 2023, it starts at $164.90 every month. And let's just imagine that 65-year-old who's collecting their Social Security benefit, so they're getting their Social Security check every month, they're signed up for Medicare. That Medicare Part B premium, again, $164.90 a month, comes right out of their Social Security check. And let's assume they weren't collecting their Social Security benefit. Well, they'd have to pay that Part B premium in. They'd have to pay in the $164.90. And that would be for the person that maybe wanted to claim their Social Security benefit at age 70, right? But they're all signed up for Medicare, so they got to pay in the $164.90 a month. Now, the other thing about Medicare Part B premiums is, guess what? It's income-based. So there is what's called an IRMA tax. Remember when I said it started at $164.90 a month? If your income's above a certain point, you may have to pay more, right? There's what's called an IRMA tax or an IRMA surplus premium. And they look at your income 2 years ago. So if somebody is applying for Medicare in 2023, they're going to look at your income in 2021, which is 2 years ago, and say, hey, was your income below this threshold? So for 2023, it's $97,000 for someone single and $194,000 for somebody filing a joint tax return. Now, Medicare will notify you and say, hey, we've identified this situation and we've said, hey, there is going to be an IRMA surplus charge here. It's going to cost you more for Medicare Part B premium, and you have the opportunity to appeal this. You can say, I had a change of circumstances, and there are a couple situations where you can fight this or appeal it to get your premium down. And so again, you'll have 60 days upon receiving that IRMA notice to file the appeal. Your retirement planner will be able to help you with this. We do this all the time for people that are higher income and get this notice in the mail. We've already planned ahead. We know what's coming. So kind of lean on your retirement planner because they have likely done it dozens and dozens of times. So change of life circumstances. So we're talking about reduction in work, death of a spouse, divorce, marriage, retiring, loss of a pension or other income stream. Those are causes for an appeal. And as retirement planners, typically it's because, okay, somebody's income is now lower in 2023 because they've retired, or maybe they're working part-time in some capacity and they were working full-time in 2021. So that is reason enough for an appeal and can help those people. And if you don't want to appeal the thing, it's really not the end of the world because that IRMA tax or surcharge will only apply for a couple of years until Medicare, Social Security sees that your income is then down. So that Medicare IRMA surcharge, that's not for life. That will eventually reset as your income goes down. Then Medicare will send you a new letter in the mail saying, hey, that Medicare IRMA surcharge is not going to apply anymore. And then your Medicare premium will then go down and adjust downwards. So we've talked about Medicare Part A. We've talked about Part B. Well, there's more parts. I'm just going to keep going here. Medicare Part C. So you may or may not choose Medicare Part C. Medicare Part C is referred to as a Medicare Advantage plan. Part C premiums are impacted by IRMA, right? So that they are income-based. For a lot of the lower income people, there will be no Medicare Advantage monthly premium. But let me boil this down. Again, your Medicare Part B premium will cover 80% of your expenses. And there is a deductible that you need to be aware of, which I mentioned. So what do you do for the 20% that you're on the hook? Well, you can choose a Medicare Part C, which is a Medicare Advantage plan. Typically, generally speaking, there's going to be a 0 monthly premium for a Medicare Advantage plan. So you might be thinking, what's the catch? Well, typically, generally speaking, you've got to stay within a network for your care. Next, you'll have an annual deductible. You'll have a bigger deductible, maybe bigger than you're used to having in your group health insurance plan. So you'll want to look at that when you're considering a Medicare Advantage plan. That 0 monthly premium might mean a bigger deductible. Also, it may include dental and vision. It may include like silver sneakers, which is like a gym membership and other benefits like that. So you'll want to check out what does this Medicare Advantage plan deliver or offer? And again, the costs. It is income-based. Got to pay your fair share. So many things are income-based nowadays. So be aware of what the monthly premium actually is if you do end up looking at a Medicare Advantage plan. For me personally, and this is my opinion, compliance department that's listening, I think for my temperament, my personality, I will not go with a Medicare Advantage plan when I turn 65. I would go with what's called a Medicare supplement plan. In my opinion, and for what I would be more comfortable with, a Medicare supplement plan, typically this is going to be an F or a G. Now, with my Medicare supplement plan that in the future I'm going to purchase, everybody has a monthly premium. You have a monthly premium. In my state, it's about $150 a month. There's no health exam. It's not income-based, but it is based on your zip code, where you live, and factors like that. Typically, you're covered. A lot of places, you don't have to get your care in a small network or something like that. So again, this is a Medigap plan. This would be a Plan G or F or an old F plan. So that's something that you might consider. But it does not cover dental or vision or that kind of stuff. So you might have to get an outside plan to cover that. And then the plan that I forgot to mention was Plan D for prescription drugs. So think when you hear Medicare Plan D, think drug, D for drug. So prescription drugs, that is a whole separate plan, Medicare Part D. It is income-based, so that IRMA tax that we talked about, that would apply to Medicare Part D. Now, I have some clients that are retired, they're healthy, they are not on any prescriptions, and so they don't have a Medicare Part D plan. It's a choice. Like I said, it is income-based, so that IRMA tax would apply, and it's a different schedule as Medicare Part B, so the incremental cost does go up as your income hits these tiers. Additionally, there are late enrollment penalties that they make you pay. So that's something that you'll want to talk to your retirement planner about to make sure you're not paying those or can avoid paying those if at all possible. Now, what I haven't talked about when it comes to these different plans, like a Medicare Advantage plan, which is Medicare Part C, or a Medigap or a supplement plan, or Medicare Part D for drug. How do you pick which plan to go with? And they're offered through these insurance companies like a Cigna, United Healthcare, Anthem, AARP actually offers a plan, Transamerica. All these different insurance companies offer plans. Well, how do you even begin to pick which one to go? And the premiums are not the same, right? One insurance company may offer a different premium than another one, their competitor. So typically how you decide is, in my experience, meet with somebody who's a Medicare specialist. I have one that I work with in my state that's here locally that'll actually come into the office and meet with our clients and go over the different plans and what they cost and the client's ability to keep their same doctors, which is incredibly important to most people. And what network of hospitals, if you do end up going with this particular plan, what is covered? What network of hospitals would you have to stay under? And then for Part D for drug plan, you would want to look at the list of prescriptions you're currently taking and compare those to the different plans and how much the copay is and what's the most cost effective, and does that plan cover your prescription? Because some Part D plans may not cover your prescription, and then you're on the hook for the whole thing. And that may not be the most ideal situation. Because if you've got a prescription that you're taking that you want to maintain, well, you want to make sure your Part D for drug plan is going to cover that. You don't want to have to be forced to adjust or change your prescription. So as I'm thinking about this episode, and hopefully it's been somewhat helpful to you, Medicare is one of those topics that is incredibly multifaceted, right? There's different parts to it. You have to understand each part, what they cost, if they do have a cost, if they are income-based or not. Will that premium for the part, will it come directly out of your Social Security check or not? For those people that continue to work past 65, you want to make sure you understand the late enrollment penalties and if they're going to apply to you. So in conclusion, I want to say, hey, Medicare planning, healthcare planning needs to be a part of your retirement plan. So I encourage you to have this discussion with your retirement planner. Ask and say, hey, what's our game plan for health insurance in retirement? Are you accounting for these Medicare premiums that you're going to have throughout the rest of your life? Because a lot of planners forget about those costs, and they're there, they're real. And not only that, they increase. Typically, these Medicare premiums go up and up and up every year. And so does your retirement plan account for those costs that are going up and up and up? That's an increasing cost that you're going to have throughout your entire retirement. And where's that money going to come from? To give you an example, some of my clients that have access to these HSAs, health savings accounts, they plan on using those HSAs to help fund their healthcare costs in retirement, which is a brilliant strategy. There's tax advantages to doing that, of course. And it's just smart to plan ahead because you know those health expenses are going to be on the horizon. So I hope this episode of the Retirement Made Easy podcast has been helpful. If you have questions, go to my website, retirementmadeeasypodcast.com. At the bottom, it'll say Ask Greg a Question. That's how you can get a hold of me. I'll see you next week. And remember, always dream big. The opinions voiced in this material are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which investments may be appropriate for you, please consult your attorney, tax advisor, or or financial advisor prior to investing. This is a hypothetical example and is not representative of any specific investment. Your results may vary. All performance referenced is historical and is no guarantee of future results. All indices mentioned are unmanaged and may not be invested into directly. The SmartVestor program is a directory of investment professionals. Neither Dave Ramsey nor SmartVestor are affiliates of St. Louis Retirement Advisors or LPL Financial. There is no guarantee that a diversified portfolio will enhance overall returns or outperform a non-diversified portfolio. Diversification does not protect against market risk. All investing involves risk, including loss of principal. No strategy assures success or protects against loss. Securities and advisory services offered through LPL Financial, a registered investment advisor, member FINRA, SIPC.
Thank you for listening to the show today. Check us out at our website, retirementmadeeasypodcast.com. And if you want some help from Greg, submit your questions at the bottom of the page or sign up for a 30-minute retirement coaching session with Greg. We'll see you next week.